My friend, Dr. Bibhuti, you missed the meaning between the lines, because
अब डिस्कशन
it,
नहीं
it
करेंगे
is
पर
it
अभी
is
करेंगे
a
ना
refractive. Patient
अब
has
डिस्कशन नहीं
some
करेंगे पर
problem.
अभी
He is
करेंगे
using glasses, and in all your references they refer to the myopic patients and the retinal detachment. You compared the anteroposterior diameter of the lens of the eye, it or myopic. So how do you say that the patient was spectacle free and he wants a presbyopic glasses? Now, tell me one thing: if the patient has got a hypermetropia, the anterior chamber is going to be shallow. There'll be crowding of the angle. Where will you put the IPCL? And the company says for its own sale that you can go up to anterior chamber depth of 2.8, but I'll never do it if it is less than 3 millimeters. And even in uncomplicated cases, everything is fine. When you inject the lens inside, many a time at the last moment,
तो सब
the IPCL they flip off. They turn it upside down. Then you are in trouble. You have to take out the lens, and there is a lot of endothelial damage. Of course, you can remove it, but it has got its own problems.
डिस्कशन कर रहा है
But in clear lens extraction, absolutely no problem. All you have to do is check the retina, check the retina, check the retina. Advise the patient to come for a follow-up, a regular follow-up. Explain the patient that these are the problems that can occur to you.
मत
That
करिए जाने जा
if you get a floaters, if you have any diminution of vision, report
सुनो ना
immediately.
जॉस में जो सब
So
है ना सब
I will say that
सुनो ना यहाँ
you
से है जॉस का फोटो डाल दो ना ग्रुप में
take into consideration all the investigations. The formula for the IL power calculation is very, very important. And then
आज कैसे डालना
during during the operation,
सिक्स्थ ग्रुप
all you have to do is
6 तारीख
you
को
have to be
डालना
very,
था
very
इससे
careful about the uh,
हम
the
डाल रहे
procedure, like um,
हैं हम डाल रहे हैं
and mind you, in hypermetropic cases, the patients are not happy with the glasses. Somebody prescribe him +4, somebody prescribe +1. The patients using contact lenses for the hypermetropia, they also not very happy. But you give them clear, if you remove the lens and put the intraocular lens, the patient is very happy. While doing clear lens extraction, you have to be very, very careful that every time you remove the lens, you have to put the viscoelastic inside. A bimanual irrigation aspiration is very, very important. And always hydrate the wound before you withdraw the irrigating probe. And I always inject a little air at the conclusion of the surgery. Well, there might be some complications that can occur, which is very normal. There might be intraocular lens dislocation, there could be a hemorrhage, there could be capsular rupture, xenodialysis, malignant glaucoma, suprachoroidal hemorrhage, and bone leakage, and retinal detachment. So before you do the surgery, you check the retina, you treat the retina, call the patient. Immediately before the surgery, you tell the patient that there might be a chances of retinal detachment. You have to come for a retina examination. During the operation, you talk to him. At the time of discharge, you talk to him. And the patient, when he goes back, you again tell them that you have to come for retinal examination because that is the only danger. So think